Hey guys, welcome back to Pharma Palette. Today we will be learning about joints, their definition and classification in a very simple way. And the lines which I say here are exactly what you can write in your exams to score full marks. So without any further delay, let's get into the video. Uh, so here is the definition of joint. So a joint is a structure of the body where two or more bones meet or connect together that may or may not allow the movement and it provides support. Now let's get into the classification. So the joints are classified based on two things. One is based on its structure and the other one is based on its function. Now let's see the structural classification. So the structural classification of joints includes three types. The first one is fibrous joint, second one is cartilaginous, and third one is synovial joint. So in the fibrous joint, there will be no synovial cavity. In the cartilaginous joint, there is no synovial cavity. But here, there is the synovial cavity presence. And the synovial joint is also having the articular cartilage and also the articular disc. So you can include these points in the synovial joint. And coming to this fibrous and cartilaginous joints, here the articulating bones, they are held together by the dense connective tissue. And here the articulating bones, they are held together by the hyaline cartilage or it can be fibrocartilage. So, what all points you will be including in these three types? In the synovial joint, just write that this will be having synovial cavity and it is characterized by the presence of articular cartilage and also articular disc. Done with this. And coming to the fibrous joint. In the fibrous joint, there is no synovial cavity. And here the articulating bones, they are held together by the dense connective tissue. And in the cartilaginous one, there is no synovial cavity, but here the articulating bones are held together with the hyaline or fibrocartilage. So this is what you have to write under each class. Now here we have seen that articulating bones. Now what are these articulating bones? They are simply the bones which join together are called as the articulating bones. That's it. Now let's get into the subtypes. So these fibrous joints are again divided into three classes. In that, the first one is the suture. Second one is syndesmosis. And the third one is gomposis. Suture is something that is present in the skull. And the syndesmosis means it is nothing but a bone that is connected by the ligament. And this gomposis is simply a peg in socket. Now let me just give you the examples for all the three. So for the suture, the example is coronal suture. And for syndesmosis, the example will be distal tibiofibular joint. And for gomposis, the example here is teeth in jaw socket. Simply write the points which I have said and also include these examples in it. So that will be enough for this fibrous one. So in the fibrous one only, we have to remember about the one more membrane which is interosseous membrane. What is this interosseous membrane? It is a thin sheet of fibrous connective tissue. So the thin sheet of fibrous connective tissue is called as interosseous membrane. And this will be useful for connecting the two bones. So here also there will be one example. It is between the tibia and fibula, or it can be between the radius and ulna. So between these bones, this interosseous membrane will be present between these bones. So you can, after writing that classification, you add some notes on this membrane as well. Now the second type in the structural classification is the cartilaginous. So the cartilaginous joints are further divided into three. One is the symphysis and the other one is epiphyseal cartilage. Symphysis and epiphyseal cartilage are the two important things under this cartilaginous joints. And here we should also remember about this synchondrosis. Now let us see the connecting material for all the three. So for the first one, which is synchondrosis, the connecting material will be the hyaline cartilage. And for the symphysis, the connecting material is the fibrocartilage. And for epiphyseal cartilage, the connecting material is the hyaline cartilage. So coming to the examples of all the three joints. So the first one, synchondrosis, can be seen between the first rib and sternum. So this symphysis can be seen between the pubic symphysis and the intervertebral joints. Coming to the epiphyseal cartilage. So this epiphyseal cartilage is simply an epiphyseal plate that is present between the diaphysis and epiphysis of a long bone. Citing the example for every class is mandatory. So that in the synovial joints, to remember its subtypes, just remember a trick. Please help poor cute smart boy. So now I'll tell you the types. So the first one is plain joint. Second one is hinge joint. Third one is pivot joint. Fourth one is condyloid joint. Fifth one is saddle joint. And the sixth one is ball and socket joint. So just remember this trick so that you can easily remember the names. So plain, hinge, pivot, condyloid, saddle and ball and socket comes under the synovial joints. Now let me give you the examples for each joint. In the plain joints, you can take the example of intercarpal joints. Hinge joint, remember the elbow joint as the example. And for pivot joint, it is atlantoaxial joint. And for condyloid joint, just remember the wrist joint. Coming to the saddle one, remember the thumb joint. And for ball and socket, remember shoulder joint, or it can also be the hip joint. That is all about the different types of synovial joints with examples. Till now, we have seen the structural classification. Now, let's get into the functional class. So, to remember the functional class, just remember the trick SAD, where S means synarthrosis, A means amphiarthrosis, and D means diarthrosis. And coming to the first class, which is synarthrosis, here just remember that there is no movement of bones will be allowed in the synarthrosis. Whereas here there will be limited movement, and in the diarthrosis there will be free movement. So in synarthrosis, no movements of bones are allowed, and in amphiarthrosis, limited movement of bones is allowed, and in diarthrosis, free movement can be allowed. And remember that this synarthrosis will be, they are tightly joined. And this amphiarthrosis, they are connected by the ligament. So skull, sutures, teeth in socket are the examples of synarthrosis. And for amphiarthrosis, the example could be intervertebral disc. In diarthrosis, just remember the example as knee joint. And this diarthrosis class is further divided into three types. So first one is uniaxial, second one is biaxial, and third one is multiaxial. Now what is the difference between all the three? So uniaxial is nothing but only one movement around the axis is allowed. Biaxial is two movements will be allowed, and multiaxial is all the movements of joints will be allowed. So that is all about the functional classification. So this is the overall classification of joints, both structural and functional. So you can have a look on it. So that's all about the joints, their definition and classification. So remember, a simple definition, clear classification and a neat presentation is all you need to score full marks. So if you found this video helpful, don't forget to like, share and subscribe to Pharma Palette for more such easy notes.